Good morning, class. The topic for the day is Clostridium botulinum. Objectives: to understand Clostridium botulinum, to understand the mechanism of action of botulinum toxin, to understand the various clinical manifestations associated with botulism, and the laboratory diagnosis and prophylaxis. What is Clostridia? Clostridia are anaerobic gram-positive spore-bearing bacilli. These spores are refractile, oval, spherical, or bulging, and the spores can either be terminal, subterminal, or central. They are motile bacteria possessing flagella except for Clostridium perfringens. Various types of Clostridia species are identified, including Clostridium tetani, Clostridium perfringens, Clostridium septicum, etc. Being gram-positive, the culture can turn to gram-negative in 48 hours. They lack cytochromes required for electron transport to oxygen. They contain flavor protein enzymes which reduce oxygen to hydrogen peroxide. They lack catalase, peroxidase, superoxide dismutase, etc. Natural habitat is soil, water, decomposing organic waste materials, intestinal tract of humans and animals. The toxin produced by Clostridia can either be neurotoxin or histotoxin. Classification. On the basis of biochemical reaction, Clostridia is classified into three. They are saccharolytic Clostridia, proteolytic Clostridia, and slightly proteolytic Clostridia. Saccharolytic Clostridia includes C. perfringens, C. septicum, and C. tertium, and they utilize carbohydrate as their source of energy. Proteolytic Clostridia utilizes protein, and they include Clostridium sporogenes and Clostridium histolyticum. And slightly proteolytic Clostridia includes Clostridium tetani. Types of infection. On the basis of the types of infection, there are various categories of Clostridia. Some of them are tetanus caused by Clostridium tetani, gas gangrene caused by Clostridium perfringens, Clostridium septicum, and Clostridium novi, food poisoning, botulism, necrotizing enteritis caused by Clostridium perfringens, Clostridium botulinum, etc. Acute colitis caused by Clostridium difficile. Now, Clostridium botulinum. Clostridium botulinum are straight or slightly curved gram-positive bacillus with rounded ends. They are non-capsulated and motile by peritrichous flagella. They are spore-bearing bacilli, and the spores can either be oval, subterminal, or bulging spores. They are strict anaerobes or obligate anaerobes, and they grow optimally at a temperature of about 35 degrees Celsius. Some strains grow and produce toxin even at 1 degree Celsius, that is in a range between 1 to 5 degrees Celsius. They show beta hemolysis on growing in horse blood agar medium. Other selective medium used for the identification or isolation of Clostridium include egg yolk agar, cooked meat broth, etc. Susceptibility to physical and chemical agents. The spores of Clostridium are highly resistant. They survive boiling of about 3 to 4 hours. Some strains survive autoclaving, resistant to radiation, UV light, alcohols, phenols, quaternary ammonium compounds, etc. They are different types of Clostridia, that is, depending on the basis of toxin production, around 8 serological types of Clostridia are identified. They include type A, B, C1, C2, D, E, F, and G, of which type E strains are inactivated by heating at 80 degrees Celsius for 30 minutes. Types A, B, and E are mostly associated with human diseases. Botulinum toxin. Botulinum toxin is the most toxic substance. These are small protein with 19 amino acid and molecular weight of about 150 kilodalton. The minimum lethal dose for humans is 1 mcg. This is a potent neurotoxin. The toxin is relatively stable and inactivated at 80 degrees Celsius for 30 to 40 minutes or 100 degrees Celsius for 10 minutes. They resist digestion in intestine. They are absorbed via intestinal mucosa in active form. They are good antigen and are specifically neutralized by antitoxin and can be toxoided. Mechanism of action of botulinum toxin. Botulinum toxin inhibits the release of acetylcholine from motor nerve endings of parasympathetic system and thereby stimulation is blocked. That is, after entry, this Bt toxin is transported via blood to peripheral cholinergic nerve terminals, most commonly at neuromuscular junction. Bt toxin, that is botulinum toxin, binds to the acetylcholine at the receptors on the nerve terminals at neuromuscular junction, which results in the blockage of release of acetylcholine, leading to flaccid paralysis. This is the mechanism of action of botulinum toxin. Repeating, after entry, botulinum toxin is transported via blood to peripheral cholinergic nerve terminals, most commonly at neuromuscular junction, where this botulinum toxin binds to the acetylcholine receptors on the nerve terminals at the neuromuscular junction. This results in the blockage of release of acetylcholine, leading to flaccid paralysis. Pathogenicity. Various causes of food botulinum toxin. That is, mainly this is caused by ingestion of the food contaminated with bacteria. This is non-invasive and pathogenicity is due to toxin. Three types of botulism identified are wound botulism, food botulism, infant botulism, etc. First one is food botulism. The source of infection is the preserved food materials, which include meat and meat products, fishes, vegetables, etc. The contaminated food can be identified by the abnormality in its appearance, that is, abnormal in appearance and odor. There won't be a normal odor for that. Putrefied smell may be there and it contains preformed soluble toxin. Bulging of tins and presence of gas bubbles on opening suggest contamination. Various symptoms associated with the ingestion of botulinum toxin are as follows, and the symptoms usually begins after 18 to 36 hours after ingestion. Various symptoms of food botulism includes nausea, vomiting, thirst, constipation, double vision, difficulty in swallowing, speaking, breathing followed by muscular weakness, blurred vision, drooping eyes, slurred speech, and death may be due to respiratory failure. This is a typical photograph. That is, this is a photograph were taken of a 17-year-old male with mild botulism poisoning. Figure A shows the patient at rest, while figure B shows the patient giving his maximum smile. The dilated pupils, drooping eyelids, and lack of smile creases around the eyes are consistent with the symptom of botulism. Wound botulism. Clostridium botulinum is occasionally isolated from wounds. The incubation period ranges from about 4 to 14 days after injury. Toxin produced at the site of infection and are absorbed. The symptoms seen are except gastrointestinal symptoms. Infants with botulism will present with the following symptoms, and this is known as infant botulism. This bacteria affects infants of age ranging from 3 weeks to 9 months. Infants ingest spore from soil, household dust, honey, etc. They multiply within the intestine and elaborate toxins. Various symptoms associated with toxin ingestion are constipation, listlessness, difficulty in sucking and swallowing, weak cry, poor feeding, altered cry, muscle weakness, ptosis, loss of head control, and respiratory arrest. Floppy child syndrome or muscle tone appears floppy. Now, laboratory diagnosis of Clostridium botulinum. The specimen to be collected include feces, vomit, gastric fluid, serum, food occasionally wound exudate. Patient excretes spores and toxin in feces. Specimen is injected into mice and they develop paralysis in 48 hours. This is known as antitoxin neutralization test in mice. The specimen is inoculated onto EYA agar, that is egg yolk agar, blood agar, and 3 bottles of cooked meat broth. They are incubated anaerobically at 30 degrees Celsius for 3 to 5 days. First bottle, that is cooked meat broth bottle, kept in water bath at 80 degrees Celsius for 10 minutes for selecting heat resistant spores. Second bottle is kept at 80 degrees Celsius for 20 minutes and third bottle is unheated for heat sensitive spores. Cultures in CMB screened at intervals for toxin production in mice. Turbidity in RCM. Black, and if there is a black and foul odor, Clostridium botulinum A, B, F. And if there is pink, that is Clostridium botulinum C, D, E. And here we are categorizing Clostridium as acarolytic Clostridia or proteolytic Clostridia. Toxin positive tubes are subcultured again onto EYA medium, blood agar, for about 30 degrees Celsius at 48 hours, and after incubation we can see pearly white opaque colonies. The growth is identified by colony morphology, gram staining, fluorescent antibody procedure, biochemical characteristics, etc. Treatment. Toxin in stomach is removed by lavage with 2 to 5% bicarbonate solution. Toxin labile to alkaline pH. Saline enemas to remove toxin from colon. Polyvalent antitoxin against A, B, E types are given. The affected nerves due to botulinum toxin cannot be reversed. Unfixed toxin can be neutralized. Intensive nursing care, use of mechanical respirators, etc. are important. Infant botulism, supported care and assisted feeding. Prophylaxis, consume properly canned and preserved food. Avoid food that shows signs of spoilages, inflated cans, gas bubbles, abnormal odor, etc. In case of an outbreak, prophylactic dose of polyvalent antitoxin given intramuscularly to all who consume the food. Intoxication, laboratory or biological warfare, injecting 3 doses of mixed toxoid at 2 months interval. In short, Clostridium botulinum is an agent of botulism, which is a rare but severe neuroparalytic disease. Morphology and physiology, they are a heterogeneous group of fastidious, strictly anaerobic bacilli which are motile by Peritrichus flagella, and they are heat-resistant spores containing ovoid or subterminal spores. They are proteolytic, non-proteolytic, or certain Clostridial species are even saccharolytic. Antigenic structure, based on the toxin produced and proteolytic activity, they are classified into various categories. Pathogenicity and determinants. They produce lethal foodborne intoxication with various toxins, infant botulism, wound botulism, etc. Various symptoms, that is early symptoms includes nausea, vomiting, weakness, lack of energy, dizziness, constipation, etc., which progress towards double vision, difficulty in swallowing and speaking, and finally death due to respiratory paralysis. Laboratory identification is done by microscopic detection or various culture identification. Toxin detection and typed in lab via toxicity and antitoxin neutralization test in mice or by ELISA. Diagnosis and treatment. Crucial to rapid diagnosis, that is, symptoms are often confusing. Note that the type of botulinum toxin involved. Ventilator support and trivalent antitoxin or polyvalent toxin binds free toxin in bloodstream. Gastric lavage and metronidazole or penicillin eliminates organism from the GI tract. Care in home canning and in heating of home canned food and toxoid is available. Thank you.